Hi guys, let's see the review of Nelson textbook of Pediatrics, volume number 1, edition 21st. From the part 9, the part 9, the human genetics, part 10, metabolic disorders, part 11, the fetus and the neonatal infant, and the part 12, adolescent medicine, 13, immunology, and part 14, allergic disorders, part 15, rheumatic diseases of childhood, connective tissue disease, collagen vascular disease, part 16, infectious disease, and the next will be continued from the volume 2. Here, first, in this video we will discuss from the part 9, human genetics. Here, part 9, human genetics, integration of genetics into pediatric practice, then diagnostic testing, then about like the prenatal diagnosis of autosomal recessive disorders, then genetic counseling, the management and treatment of genetic disorders, then chapter 95, genetic approach in pediatric medicine. The table column is given for useful internet genetic reference site. The human genome, the double DNA double helix is given model. Then how the flow of information of DNA to RNA in the hypothetical genes of 3 exons and 2 introns. And here the main classes, groups and subtypes of variants of all protein products are given, like substitution, deletion, insertion, duplication, etc. Here genotype, phenotype, correlations in genetic disease. And here the chapter number 97, patterns of genetic transmission, Mendelian inheritance. This is the pedigree symbols mainly used, and the definitions and abbreviations are given. Pedigree line definition, here reproductive technology symbols and definition, and here pedigree symbols and genetic evaluation and testing information. Here autosomal dominant pedigree, here autosomal recessive pedigree, here incomplete penetrance. Then about X inactivation. Then here the range of tissues of clinical phenotype. Then clinical algorithmic for genetic diagnostic testing of mitochondrial DNA. Here tabular column for diseases associated with polynucleotide repeat expansion. Then about cytogenetics. Here the diagrammatic representation of FSH analysis of interface peripheral blood cells of using Down syndrome. Then here the diagrammatic representation like chromosomal DNA on slide. Then face of a child with Down syndrome, that is karyotype with a male with trisomy 21. Then this is the radiological findings of prehensile foot. Then about sex chromosome aneuploidy like Turner syndrome, Klinefelter syndrome. Then fragile chromosome sites. Then here uniparental disomy like Barder-Willi phenotype. The picture is shown clearly. Then about genetics of common disorders. Then chapter number 100, epigenome void, association studies and diseases. Then about metabolic disorders. Here the pathways of phenylalanine tyrosine metabolism is given, and the other pathway involving tyrosine metabolism. Then about pathways in the metabolism of branched chain amino acids. Then like defects in the metabolism of amino acids like histidine, lysine. Then defects in metabolism of lipids like mitochondrial fatty acid oxidation. Then milky plasma for patient with acute abdominal pain. Then tabula color for lysosomal storage disorders in newborn period. Genetic and clinical characteristics of neonatal presentation. Then defects in metabolism of carbohydrates, liver lichogenosis, glycogen storage disease. Then pathway of related to glycogen storage disease and galactose and fructose disorders. Then these are the features of disorders of carbohydrate metabolism. Then about mucopolysaccharides. Then about pathways in urine metabolism and salivage, disorders of urine metabolism, urine and pyrimidine metabolism. Then about porphyria, like congenital erythropoietic porphyria. This diagram is given. Then about hypoglycemia. Then the fetus and neonatal infant, overview of morbidity and mortality. The epidemiology of neonatal mortality rate in 2012 is given, and the graph of preterm birth at the function of infant mortality rate at 40 countries. Then newborn infant with intrauterine IG or intrauterine growth restriction. Then about antiseptic skin and cold care. Then about the fetus, the fetal distress, how the graph of fetal measurements should be done, like gestational age per weeks, how it will go. Then patterns of periodic fetal heart rate, FH deceleration is given in the graph. Then fetal intervention and surgery, obstructive uropathy. Then non-obstructive renal disease, congenital diaphragmatic hernia. Then high-risk infant, classical fission theory of twinning. Dizygotic twins result in two distinct fertilization events. Then fusion of monozygotic twinning. This is a maturating rating. Then clinical manifestation of disease in the newborn period. Then here are the sites of extracranial and extradural hemorrhage in the newborn. Here are the radiological findings. Then about neonatal resuscitation and delivery room emergencies. Here in this, estimates of infant requiring resuscitation at birth is given. Then about respiratory tract disorders. Here apnea, like prognosis, prematurity, prognosis, treatment. And respiratory distress syndrome, RDS. Here the infant with respiratory distress syndrome is given in radiological findings. Then about dysmorphology, like examples of malformation with distinct causes, mechanism, definition, dysmography. Then about adolescence medicine, adolescence physical and social development, like sexual maturity rating stages in female, how the sexual maturity ratings will happen, all those things. Then gender and sexual identity. Then epidemiology of adolescence health. Tabular column of each chapter is given briefly. Then about substance abuse, then breast, then menstrual problems like amenorrhea, abnormal uterine bleeding is given, irregular menstrual bleeding, dysmenorrhea. And here the effectiveness of contraceptive methods like contraceptions in the chapter contraceptions, like contraceptive counselings. Then sexually transmitted infections. Then primary defects of antibody production. How this IgG subclass deficiency will happen. Then monocytes, macrophages and dendritic cells, like functional activities, activation, upregulation functions in macrophages, activated response to infection, disorders of phagocyte function. Then about infectious complications of hematopoietic stem cell transplantation. Then childhood asthma, etiology, main epidemiology is given, and asthmatic inflammation, how it will enter to the body, that is given in that, like pathogenesis. Then in pathogenesis, clinical manifestation diagnosis, differential diagnosis. Then about radiological findings. And like allergic disorders, skin manifestation, respiratory manifestation. Then treatment of rheumatic diseases, rheumatoid arthritis. Then juvenile idiopathic arthritis is most common in children. The main etiology, causes, pathogenesis, clinical manifestation. And here the oligoarticular juvenile idiopathic arthritis. Then SLE, systemic lupus erythematosus. Here mucocutaneous manifestation of SLE like malar rash, vasculitis rash, oral mucosal ulcer, discoid rash in malar distribution. Then Kawasaki disease, that is, the patient will suffer from the strawberry, it looks like strawberry tongue. Then about immunization practices, like it's a main preventive measures like passive immunity, active immunity, intramuscular immunoglobulins, monoclonal antibodies, vaccination protection, findings, financing. Then about healthcare advice for children traveling internationally, like pneumococcal vaccines, measles, mumps, rubella vaccine, influenza vaccine, hepatitis A, B, Haemophilus influenza type A, diphtheria, pertussis, tetanus vaccine, polio vaccine, varicella, cholera. These are the travel vaccination for children like hepatitis A and B, immunoglobulin, meningococcal polysaccharides, rabies, typhoid fever and yellow fever. Then fever without a focus in a neonatal and young infant. Here the main etiology, epidemiology, clinical manifestation, diagnosis, laboratory diagnosis given. Then fever in older children. The etiologies of fever in children more than 2 years of age, like 2 months of age, sorry. Principles of antibacterial medications. Then group A, Streptococcus. The main group A, Streptococcus, is also known as Streptococcus pyogenesis. Etiology, diagnosis, pathogenesis. Then Neisseria gonorrhea. This all will comes under infectious disease. Injella kingae. Then sangroid, Haemophilus ducrei, syphilis, sexually transmitted disease. And then Moraxella catarrhis, pertussis, Bordetella parapertussis. Then Shigella. This is a main causative agent for dysentery. Then Escherichia coli, cholera. The child lying on with cholera is shown, and rice water stool in a patient with cholera. Then about anaerobic bacterial infection, that is Clostridium botulinum, tetanus, Clostridium tetani. Other anaerobic infections, like Clostridium, myonecrosis, gas gangrene, and mycobacterial infections, principles of antimicrobial therapy, tuberculosis, Mycobacterium tuberculosis. And here in tuberculosis of the spine of the total is given in the radiological findings. And about syphilis is given. Huntington's teeth on the late manifestation. Then about typhus group pertussis. Then about fungal infections, principles of antifungal therapy, like Candida. Then coccidosis species, chest radiograph of 19-year-old man, paracoccidosis, sporotrichosis, mucormycosis, pneumocystis jirovecii. These all comes under infectious disease. The non-polio enterovirus. Then about respiratory syncytial virus, rotavirus, calcivirus, and astrovirus. Then yellow fever. Then polymorph viruses. Then in each of the chapter, the tabular column is explained in detailed manner. Then about human T lymphotropic viruses. Then flowchart for approach to patient with malaria in United States, like Plasmodium falciparum is the most dangerous one. Then Plasmodium vivax, Plasmodium ovae, Plasmodium malaria. Then about hookworms, the main causes, epidemiology, how it get transmitted to the human body. Then about trichuralis, then strongyloidiasis, then about lymphatic filariasis, the main chest radiograph of woman with tropical pulmonary eosinophilia is given. Calabar swelling of the right hand. Then toxocariasis, trichonellosis, schistosomiasis, the main etiology, epidemiology, then pathogenesis, the lifestyle of schistosomiasis, and clinical manifestation, diagnosis, treatment. Then flukes, adult tapeworm, cysticercosis, then echinococcus granulosus. Its main is otherwise called as hydrated disease or hydration. Then about cure, pathogenesis, clinical manifestation, diagnosis. And here in this epidemiology, the whole world map is given, worldwide distribution. Then about prognosis and liver cystic echinococcus. That's all. Thank you.